In healthcare, effective, potentially life-saving care comes down to the accuracy and utility of medical imaging. CT and MRI scans provide essential information, but a 2D cross-section can only provide so much information, particularly to non-radiologists. To make the images more intuitive and useful, imaging specialists can glue long sequences of these images to 3D representations, fusing 2D pixels into 3D voxels, and thus creating a sort of Minecraft landscape. To extract a 3D structure from this landscape, they select a color and have the system strip away any other voxels that don't match. The remaining voxels turn into a smooth mesh. If only it were always that easy. In practice, models often end up misshapen. Extracted objects pick up extraneous nearby voxels or omit important object pieces, and there's no easy way to correct these errors. Texture information is usually simplified to a single color, which is fine for evaluating shape and size, but may lead to missing subtle details in surrounding tissue. To illustrate, imagine how a fake texture will make an apple look perfect, causing you to miss the discoloration, hiding the caterpillar within. Without Scanogram's detailed texture contrast, the perfect and flawed meshes look identical. We ought to be able to manipulate the object and expose its insides as we like. All the data is there, right? But often we can't. So doctors, sensing a problem with the extraction or their interpretation of it, want to consult with a specialist. Only that doctor is off-site, and audio-only calls can't really convey 3D features, even with the cumbersome addition of emailed images. The medical industry needs an easy, intuitive way to put doctors in the same virtual space and give them the power to collaborate with shared 3D scans in real time. Scanogram provides this. To enable a seamless, fluid environment for co-manipulating these data-rich models, we turn to pre-processing voxels in the Microsoft Azure cloud. Within Azure, voxel cubes convert into small wireframe meshes and high-res textures for those meshes, crucially showing all possible detail from the raw data rather than a single-color fake texture. In this way, superior quality models stream directly to HoloLens devices at high resolution. The quality and collaborative nature of Scanogram can enable one doctor to zoom into a feature to show another doctor, or perhaps both want to alternately sculpt away or restore certain areas. Manipulating 3D objects with Scanogram becomes a snap. You can control sculpting tools with your gaze, guide them to a model, then tap to remove or restore voxels. With the extraction tool, look at a part of the structure you want to extract and just tap. The cloud does the rest. Scanogram works with Skype to make collaboration simple. When the caller and receiver run both Scanogram and Skype, they can view and manipulate the same model from their respective positions. They might flip into the partner's view, flip between single share control, or even have one doctor present to a large group. Scanogram's flexibility provides 5 different types of annotation, each assigned to any number of points on the model. Markers include markup shapes, and measurements determine distances as you draw them. Text can be typed, but audio dictation and freehand drawing with the pinch-hold gesture are even more efficient and intuitive. Ultimately, Scanogram will bring a higher level of care into the medical field by accelerating doctors' scan analyses, assisting in more accurate diagnoses, and facilitating an easier sharing of knowledge. In an industry desperate for better ways to turn data into patient recovery, Scanogram will lead the way.